Once an animal had a diagnosis of a brain tumour, it used to be a death sentence. If an animal needed an immediate scan, it couldn't get it. Having had to take thousands of animals to human hospital after hours under difficult conditions, the whole concept of partnering with other vets throughout KZN and having a dedicated animal scanner available 24 hours a day, that really just spoke to me.
Your vet has just said the word MRI, and immediately you're thinking, this is going to be serious. It's going to be expensive, or even that you're pretty frightened. But what does MRI actually mean, and is it truly necessary? Today, I'm joined by Dr. Martin Descali, specialist veterinarian at Hilton Veterinary Hospital, to unpack advanced imaging in a way that makes sense. We're going to talk about MRI, CT, and X-ray, and what each one actually shows, how veterinarians decide which one to use, and what the safety considerations are, and how owners can approach these decisions feeling informed rather than overwhelmed. If you've ever been told your pet needs advanced imaging and felt unsure or anxious, this episode is for you. Martin, welcome to the Pause and Effect podcast. So, Martin, I'm really excited about this conversation because you're about to launch an MRI service here in KZN, which is a significant step for veterinary medicine in our region. How does that feel for you personally and professionally?
I think it's been coming, basically ever since I specialised and understood the need for it, and having had to take thousands of animals to human hospital after hours and under difficult conditions, and not had sort of point of care access to a machine, and also be reliant on their generosity to run the scans, and then of course to not have the opportunity to try and bring some economy scale to the scan. So we were always paying prices for vets after hours and what the human hospitals needed to charge us for the scans. And so the whole concept of partnering with other vets throughout KZN and having a dedicated animal scanner for animals in KZN that's point of care available 24 hours a day, that really just spoke to me.
Oh, it's incredible. I mean, you make mention of the fact that you were utilizing human hospitals. What did that process look like logistically? I mean, you were mentioning having to do those after hours. I take it, these hospitals can't have dogs and cats coming through their doors whilst they're operating for humans.
Well, firstly, it was extremely generous of the radiologists, the human radiologists, to allow that and to give us the opportunity so that we didn't have either, no availability to MRI scan or CT scan at the time. But from a logistics point of view, you'd have to wait. If an animal needed an immediate scan, it couldn't get it. If they weren't available to help us, because they obviously have their own bookings, then you'd sometimes have to wait days. And if it was on a weekend, you'd have to wait till the Monday. So if it was Friday evening, the next time you got a scan was 3 days later. And then if we were always doing a lot of neurosurgery when it came to spinals. We're starting to do intracranial surgery. So once an animal had a diagnosis of a brain tumour, it used to be a death sentence. And these days, certain tumours with certain characteristics are removable. But
it's incredible.
To do that, you need a point of care scanner. So you need to do post-operative scans. You need to do follow-up scans. And, the anaesthetic can be an issue. So having it in-house, it makes it easier and safer and actually more economical.
And did those limitations ever affect clinical decision-making or patient outcomes?
Yeah, they would. So if we had a patient seizuring post-operative after a brain tumour removal, we wouldn't know if that's just normal or if the animal had a bleed, something like that. And so you'd have to guess to try and help the animal. and you wouldn't have access to points of care scanning to see what had happened so that you could intervene immediately.
So how is having your own dedicated veterinary MRI facility going to change things for the referring vets and for patients?
So we already run a referral hospital, and so we feel that it will just bring us stronger collaboration with our partners, and they'll be able to we'll do continuing education so that they can identify which animals need scans or should get scans. And then the process is very slick. They simply phone us, say we need a scan done. We organise a time. They either send the animal up with an ambulance or the owners bring the animal themselves. Then some of the veterinarians bring the animals themselves. We do the scan. It gets reported on by a veterinary radiologist. And then a decision is made for that animal and either go back to that veterinarian if they have the capacity to help the animal further, or if it's an end-stage diagnosis, such as a non-operable brain tumour, we'll go back to that facility for palliative care. And if the owner wants it and the referring vet wants it, and it is something that we can deal with in our neurosurgery department, then it'll stay and get treated.
So before we unpack some of the more technical sides of the MRI, I'd like to start with something a little bit more personal. What would you say is the most rewarding moment for you when imaging finally provides an answer?
Well, I've always believed that a diagnosis is the absolute cornerstone to any successful treatment. So, obviously you don't want a diagnosis where you can't fix the animal. You'd prefer to get a diagnosis that is treatable, And I think what's been really great for me is I've worked with some very competent and talented surgeons in my lifetime. And I currently work with Dr. Boyd, who is one of them. And just knowing that it isn't always an end diagnosis. I think working out that something is removable and treatable, and just giving owners realistic and, honest hope that you can fix something. And especially if it was presented as something they thought couldn't be fixed. I guess that's that kind of thing.
Absolutely. So for those listening who may not fully understand it, can you explain to us just in really simple terms what an MRI actually is?
Sure. An MRI basically uses magnetic energy to produce an image. Different tissues will release different energy from that magnetic field. And the magnetic field is applied and then released, and the tissues, as they reorganize, they release energy. The MRI reads this energy because each tissue and each different type of tissue, for example, water will release different energy to fat. It gives you an image that a computer generates. And that is simply what an MRI is. And it's much more sensitive than a radiograph or a CT in tissue differentiation, because a radiograph or a CT is really just measuring how X-rays penetrate through different tissues, whereas the MRI is actually measuring different tissue energies. So it's got a lot more differentiation.
So in terms of case selection, is there still a place for CT and X-ray?
Absolutely. So in general, CT will look at bones and lungs better than an MRI, whereas MRI will look at soft tissues better than a CT. So when it comes to looking at brain tissue, you can't match an MRI. An MRI can give you very valuable information on joints, for example, that a CT won't give you because it'll pick up soft tissue swelling. For example, my recent accident, there was nothing on CT or MRI, and they realized I'd ruptured the quadriceps tendon, which was only visible on MRI. The leg was swollen about 3 times normal, so you couldn't palpate it. You had to use imaging to make the diagnosis.
You look at me, I look at you, I see the love in your eyes. I'm lost.
Health you can see, love you can feel. UltraPet, the science of love.
So when you're working up a case, when do you first start thinking this patient needs an MRI?
Okay, so every case starts with the full clinical and history, and very quickly you'll be guided into what syndrome the animal is presenting with. And if it's a neurological syndrome, then very basically you divide it into intracranial and extracranial causes. So, for example, if an animal presents with a lot of clinical signs that are consistent with the toxicity, then it's unlikely that you're going to rush to an MRI. But if it's had unilateral head signs that are progressive and suddenly start seizuring, that's a good indication to rush to an MRI.
So symptoms like seizures are often red flags for you that sort of advanced imaging is necessary unless the history indicates that this could be a toxicity or idiopathic. Are there still the idiopathic epilepsies that are benefiting from MRIs?
Yes. So actually, idiopathic epilepsy is a diagnosis of rule out. So a lot of idiopathic epilepsy gets diagnosed as such, and meantime it's secondary epilepsy. So there is a brain tumor there, and it may not be very big, but it may be causing epilepsy. And so there's a few criteria that one looks at. So the first is the age of onset. So if it's idiopathic epilepsy, it's usually from about year 3 to 7 that the animal will present. Younger than that, you're thinking of infectious diseases or trauma or toxicity, because that's when they eat the things they shouldn't. And older than that, you're starting to worry about structural lesions like brain tumors, But obviously there's an overlap in any age that could be confusing, but that's in general. Now, idiopathic epilepsy, sort of standard treatment is to check that there aren't any congenital metabolic diseases like liver shunts or any organ failures like renal disease. And then after that, you really are saying, well, are there any residual neurological signs in between the seizures? And a very careful neurological exam might elicit that there is actually a neurological abnormality in that animal. So, for example, as an extreme, you could be shining a light into the eye and looking at the pupil response, and the pupil can't accommodate properly. And this could be your only neurological sign, and that's called hippus. And that could be a sign that the animal has got a brain tumor. Whereas a true idiopathic epilepsy would have, outside of the seizures, remember during the seizure period, the prodrome, seizure, and aura, you can have neurological signs that disappear over time. But if you find neurological signs and there isn't any seizure activity, then the MRI is strongly indicated.
Before I move to spines, because this is also something I know that you deal with commonly, can MRI differentiate between inflammatory brain disease and brain tumors, for example?
It can, and especially with the more modern scans coming out, there's something called a house scan. It can actually very nicely differentiate whether fluid and edema is caused by inflammation or caused by tumors, and it's around the tumor, for example. So, they can very nicely differentiate inflammation from tumors.
So, on to our paralyzed patients. If a dog suddenly becomes paralyzed, how urgent is it to perform an MRI?
Okay, so there, again, are criteria and gradings. And if we go to the most common thing that happens, you either have a little bulldog, French bulldog, or a Dachshund, and all of a sudden they go paralyzed. And then we normally look to see what is the neurological state of those legs. So we try and localize the lesion to exactly where it is. And that a lot of that is just palpation of the spine to see where there's a hypopathic point. And then also using proprioceptive studies and different neurological tests that we do on the patient to try and localize the lesion. And then there's something very important, which is deep pain. So if an animal has lost deep pain, now deep pain is not just if you stimulate the toe and the leg gets withdrawn. The animal actually has to show a pain response, usually showing by trying to turn around and look at what you're doing. And if there's no deep pain, it's advised that surgery gets done within 24 hours to still have a chance of recovery. And if it is done within 24 hours and the MRI scan agrees that it's feasible to do the surgery, then the prognosis is very good. Whereas if it gets left in a cage and it's 2 or 3 days down the line, prognosis is now very poor.
And how does MRI assist in planning these surgical interventions, particularly for these spinal cases?
Well, it's an interesting question, though. I know of vets. At one stage, I lectured for the World Small Animal Veterinary Association throughout Africa. And I know of vets that don't even own X-ray machines that would go and operate on a disc based on palpation and clinical science. And I'm sure they did a lot of good, but they also sometimes went in where they thought the problem was and it wasn't there. So I think it's just all about planning and taking away risk and making sure you know exactly where you're going to go. Some of the cases Dr. Boyd does are 80-kilogram bulls with a disc in the neck, and she does a window surgery down to that disc and removes it. And you could not do that without imaging. You'd just be hopeless. It helps you choose a side. So clinical science can help you choose a side. Remember, the cord can be pushed to the opposite side and crushed on the opposite side to where the disc is. So sometimes the clinical science can be misleading. Yeah, so imaging is everything when it comes to discs. But then we also see things that look like discs, like infarcts of the cord and fibrocartilaginous infarcts, which is tiny pieces of cartilage material that get stuck in the disc, in the spinal cord. And we see explosions of the liquid part of the disc, and those are not surgical cases. So if you went in and operated, you would not benefit the animal. You'd actually just cause more harm. And those are cases that, with appropriate rest, can come right. And actually, those are cases where you could have even lost deep pain because this material can reach the center of the cord where it causes its problem. And actually, the rest of the cord can be almost fine. And 2 or 3 months of rest that animal can be fine. It may be euthanized because it doesn't have deep pain just because imaging wasn't done.
That's incredible. Yeah, how it can change the outcome quite dramatically.
Yeah.
So one of the questions I have in my research noted that owners often ask Google is, if my pet has had a hip replacement, can they still have an MRI? What about plates, screws, pins, previous orthopedic surgeries? Even my pet has a microchip, can they have an MRI? Tell us a little bit more about MRI and the limitations.
Okay, so metal would be an issue with the MRI. The machine we're getting has been veterinary dedicated, and they have looked at, they call it suppression, to try and be able to do MRIs in cases where there is metal present. You don't want to go into the MRI with a pacemaker on. that would be a fatal event. But a plate would be fine. You would have to just suppress the scan where the plate is. So you wouldn't be able to get imaging of the actual bone where the plate is placed. But if it was a hip replacement, we'd still be able to scan the spine.
Okay. So can MRI damage implants or cause heating or cause any other issues if you're unaware of it?
Yeah, it can, but you'd have to be an extremely high field MRI, like a 10 Tesla. And I don't even think there's a 10 Tesla in South Africa for humans. So, the MRI that we are going to put in is called a low field MRI. So it has a low cost, but it's technically very advanced with AI software, and it's dedicated, all the sequences are dedicated to animals, and they've been worked on, the coils are dedicated. So the imaging quality that we get is excellent, and it doesn't have some of the benefits of a high field, which basically is a shorter scan time, but it's got a lot of other benefits. One of them including being very good at doing joint MRI.
Excellent. That's great. So how long would an MRI scan take?
About 30 minutes for the whole
and
scan.
Obviously, most patients have to be anesthetized. Is that right? So how do you safely monitor these patients that are anesthetized during the procedure?
Every single animal is monitored with veterinary dedicated monitors. And we have the monitors outside of the MRI field so that they don't interfere with the MRI. So it's the way the room is set up, with cabling, etc., into the room, but the machinery outside. And so the anesthetic is literally the same as doing any other anesthetic in our hospital. We're also very lucky to have Dr. Kenneth de Beer to help us set everything up and to be around for most of the scans.
So no higher risk in terms of the anesthetic associated with the MRI than for any other procedure?
Cara, you have to remember some of the patients you're dealing with are on the edge and already critical. Mm. So they do class anesthetics into different grades of risk. And some of those patients will be old animals and be sort of a grade 4 risk. But it will certainly be a lot less risky than in our hospital with all our staff around and all our facilities and monitors than trying to do it in a human hospital.
So another common question, the Google search question, was from owners, is there a radiation risk with MRI?
Yes, so absolutely not. There's absolutely no risk. So with CT, there's radiation risk. Even with normal X-rays, there's radiation risk. But an MRI does nothing to you, nothing harmful to you whatsoever.
Let's talk about the cost of MRI, because I know that is going to be something that people are itching to understand, sort of just to get a measure of whether this is something that they can truly afford. How do you approach this, especially in terms of the value that they get from the actual MRI itself?
So I think the cost is always a difficult one for vets, and the difficulty is you have to be able to keep your doors open and pay your bills to be there to treat the next animal. So we do have this dilemma all the time between giving best treatment and what it costs. And owners can take a lot of that away by putting the animals on medical aids. And if they can, not choosing the sort of lowest option, but choosing a meaty option that is going to pay for this kind of treatment if that's what they want for their animals. Mm-hmm. I think we're quite lucky in veterinary science in that if something is determined to be end stage and the animal's suffering, we can choose euthanasia. But we're also lucky in that we can do a lot of what is done in human medicine now for animals. And I think the important thing is to explain everything to the owners, to explain the costs to them, and then give them the opportunity to make a decision of what's best for them, you know.
Absolutely. But I mean, I think in terms of the cost, the figures are thrown around, and I would urge owners to have that conversation with their vet, because I'm actually surprised at how affordable it is, especially in terms of the impact that can have on the course of the progression of the case. We see cases that may sit with hospitalization for a period of a week, and that you may alter that whole plan. And a lot of the cost saving comes with time, particularly time in the hospitals and time with care and treatment, especially if it's not aimed at the right diagnosis. But how often do you have to counsel owners when the outcome may not change things, and even if we have a diagnosis, that the outcome's not going to change as a result of the MRI or at least the advanced imaging? Yeah.
So, Cara, I think if you absolutely know that, you wouldn't need the scan, you see. So 99% of the time, perhaps when it comes to idiopathic epilepsy, or if we strongly suspect idiopathic epilepsy, then the scan's just a rule out. So it's possible to leave it out, put the animal on treatment, monitor the response. But the problem with that is if it doesn't respond, you've lost time. And in a case where you simply don't have a diagnosis, so you have an animal with unilateral neurological signs, and that could be inflammatory, it could be vascular disease like a stroke, it could be a parasitic cyst, it could be a brain tumor, it could be meningitis, it could be trauma with the bleed, it could be an aneurysm that ruptured. There's so many things it could be. And so if one kind of looks at what I call the retrospectoscope, so you're doing tests because you have differentials and you can't make a clinical decision with the information you currently have. So if you then do the scan and you find out it's an infarct, and the treatment is now to treat a stroke in an animal, basically, and they have a very reasonable prognosis, the owner can't say, well, why did you do the scan? You should have just treated it. Well, we didn't have that information before doing the scan. And so you can't do that. You have to look at what you have at the time. And if there are too many possibilities with too many different treatments, then you need the advanced imaging to guide you.
Quite right. And would you say access to MRI has changed the way that we approach quality of life discussions?
No, definitely. It also opened up the opportunities to treat certain diseases that previously we didn't treat, So having access to the technology has allowed us to look at over hundreds of thousands of cases, not just myself, obviously, but radiologists and specialists all over the world, to look at cases and treat them and then see what the outcome is. And then go back and say, well, if we have these criteria on an MRI, it's not an end-stage disease, it's treatable, And obviously for surgical planning, so one of the things they look at with brain tumors is, are they intraaxial or extraaxial? So most brain tumors that are extraaxial are actually outside of the brain membranes, but crashing onto the brain. And with a craniotomy, you can have direct access to that tumor and remove it off the brain and have a very good outcome. And obviously, the earlier that's diagnosed, the better. So if it's pea-sized when it's diagnosed, the prognosis is extremely good. If it's cricket ball sized when it's diagnosed, well, the prognosis is obviously different.
absolutely. I can understand that. And what would you say one of the biggest misconceptions you frequently encounter from pet owners associated with MRIs?
To be honest, I think I'm very privileged in that I have lots of veterinarians seeing animals and screening them, and then often speaking to me on the phone about them. And then, so I've already had a screening process done before I see the client. And for me, it's quite easy. If I really believe it's indicated, I have that discussion with the client. And like I say, I'm probably biased because that discussion's probably already taken place before they come to me. But I don't find a lot of people not wanting to help the animal. And I love GP chat. Like, to me, it's revolutionized my job because people often come in saying, I think my dog needs an MRI. And I look at how they've got to that decision and I tell them if I agree or not. And that's very easy to persuade them. And theoretically, most of the time, the decisions we come to are going to be the same as AI because we put in parameters and clinical signs, and we're following algorithms, and we should come out to the same decisions most of the time. Occasionally, something's, you get out the information you put in. So occasionally the information put in is a little bit misguided. And if you redirect it, then you get the right answers. But like I say, it should align with what we're telling the owners. And if they've done that homework, all the better. It's a very easy persuasion.
And if you could give one piece of advice to vets who are considering MRI for their patients, what would it be?
I think maybe I'm a little weird in that I've moved on a bit in age and I still study every day and sometimes hours. And I just feel the more I know, the more excited I get about these things. So I would say to vets, you do need to embrace this new technology. The days of leaving an animal in a cage to see if it gets better, I think that's going to irritate most pet owners these days. So I would say embrace it. As far as KZN is concerned, it's very exciting because we're not only building on to put in the MRI, we also put in a conference center. And we're going to offer CPD to all our colleagues, whether they're involved in the machine or not. And a lot of the CPT is going to go around advanced imaging and the benefits. We also plan to have a newsletter for the vets involved that wants it and have a case of the month to highlight how it's benefiting animals. So I think it's very exciting, and I think it's uplifting for veterinary science and KZN overall.
I totally agree. I think it's really, really exciting. And finally, when you look back in a few years, what would success look like for you with this new facility?
Sure. Just that it's achieved what I hope it achieved, and that all those things I've just said, that vets are collaborating, everybody's benefiting, the patients are benefiting, and we've covered a lot of diagnostics and treatments that have been beneficial to our patients. I think just looking back and seeing how far we've come, that's all.
Yeah. I mean, there definitely is an expectation for us to be offering more, doing more. We are really privileged to have your facility and being able to refer, because we obviously are limited. We haven't had that advanced training, or we don't have the advanced facilities. So, to be able to refer cases that we've reached our professional limit, to be frank, and be able to offer that to our clients is a great privilege. So thank you very much for all that you're doing. When can we expect it to be up and running?
Okay, we're expecting the 1st of June. Yeah.
That's great.
That's the target date.
Before we know it, it'll be up and running the way life goes at the moment. You blink and it's another year, so that's very soon.
Yeah.
Well, thank you very much for your time and coming on and explaining things. I know that we could go into particular case examples, and like you say, hopefully at some point we can do that for owners, because I know you're going to be offering that for the vets, so that also, we can recognize the cases that really will benefit from this facility. So I'm very, very excited for you, for KZN, and for our clients that this is happening pretty soon. But thank you for taking time out of your busy day. It's been a very informative chat.
Thanks, Cara. Thanks for having me.
Thanks, Martin. It's been such a pleasure. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.